Hello, my name is Rachel and I work for Step 2 Young People's Health Charity in Bradford. This video is about fertility. Fertility can be a really emotive and really difficult subject for some people to talk about. It's worth remembering at this point that not everybody wants to have children, and not everybody who does want to have children can have them naturally. So fertility refers to the natural capacity to conceive a child. Infertility is the inability to conceive naturally after 1 year of unprotected sex. According to verywellfamily.com, 11% of all couples will experience infertility, and both men and women can have fertility issues. So some possible signs that there might be an issue. You are aged 35 or older and you've been trying to get pregnant for 6 months unsuccessfully. Being under 35 and having unprotected sexual intercourse for 1 year without managing to get pregnant. You've had 2 or more successive pregnancy losses, and you have any of the risk factors for infertility. So some of the most common symptoms then, there might be irregular menstrual cycles. They could be unusually light or heavy bleeding with bad menstrual cramps. It could be that there's unusually heavy periods or abnormal menstrual bleeding. There could be pelvic pain or pain during sex. And there could be some kind of sexual dysfunction, which would include erectile dysfunction or a low sex drive or libido. There are various causes for infertility. It could be down to your age. As we get older, our fertility decreases. There could be some kind of chronic illness which might affect it. There may well be hormonal imbalances. Some kind of disease of the reproductive system like polycystic ovaries. There could be infections in the reproductive tract, and that could be things like untreated chlamydia. There might be side effects to medication that you're taking. Obesity has an effect on your fertility. An unhealthy lifestyle can impact. It might be that there are poor quality eggs or semen, and that could be down to a number of things. It could be that they've always been like that. It could be that they're decreasing due to age. But there are also a number of unexplained reasons for why people are struggling to get pregnant. The NHS do offer some fertility treatments. There can be medical treatments for lack of regular ovulation. So if you're not releasing an egg every month, it could be that surgical procedures are needed for women suffering from endometriosis. There may need to be some repair of fallopian tubes, removal of any scarring within the womb or abdominal cavity. And it could be that there is assisted conception, so there's IUI or IVF. Treatment offered will absolutely depend on what is causing the fertility problems and what's available in your local area. Private treatment's also available, but it can be very expensive. There's no guarantee that it will be successful either. So IUI, or intrauterine insemination, it's also known as artificial insemination. It involves inserting sperm into the womb via a thin plastic tube that's passed up through the cervix. So you can see it in the diagram there. The sperm is first collected from the gentleman. It's washed in a fluid. Best quality specimens, basically the fastest swimmers, they're selected. In IVF, the egg is taken out of the body and it is fertilized outside of the body. Fertility medicine is taken to encourage the ovaries to produce more eggs than usual. The eggs would be removed from the ovaries, they're fertilized in the laboratory, and a fertilized egg is then returned to the womb to grow and develop. Often more than one egg is fertilized, which is why some women who've had IVF will have multiple babies in one pregnancy. It's worth mentioning at this point that yes, these are available on the NHS, but that they may not be free. It may be that you need to contribute financially, and it may be that you do not qualify for support through the NHS. As you can see at the bottom of the slides, there are links to NHS pages, and that is because they will give you the most up-to-date and relevant information and advice about what is available to you, what you are eligible for, etc. on the NHS. It is possible to also have egg and sperm donations, and for some people these are an absolute necessity. In same-sex partnerships, if two women are trying to conceive, they will obviously need a sperm donation. For two men trying to conceive, there are other methods, surrogacy, etc., that they can use in order to be able to have their own family. If you or your partner has an infertility problem, you may be able to receive eggs or sperm from donors to help you conceive, and treatment with donor eggs is usually done using IVF, so the egg is fertilised outside of the body and then implanted in. Anyone who registers to donate eggs or sperm after the 1st of April 2005 can no longer remain anonymous. You must provide information about your identity at the point of donation. Previous to that, you didn't have to give your name, or you could give a different name to be able to donate. And that's because a child born as a result of donated eggs or sperm is legally entitled to find out the identity of the donor once they've become an adult. It does not mean that the person who's donated it is automatically their parent and has to have some kind of involvement in the family. That's not what it means, but it does mean that the young person has the right to find out who donated sperm or eggs. Another element of fertility is the menopause, and this happens in women, and it's when a woman stops having periods and is no longer able to get pregnant naturally. So the periods would start to become less frequent over a few months or years before they stop altogether. For some women, they can just stop suddenly. 1 month you have a period, the next month you have no more. The menopause is a really natural part of ageing. It happens to all women, and it usually occurs between the ages of 44 and 45. And that's because the estrogen levels in a woman's body are declining naturally. In the UK, the average age is around about 51. But around about 1 in 100 women will experience menopause before the age of 40. That's known as premature menopause or premature ovarian insufficiency. Menopause can give you lots of different symptoms. It can be very difficult for a woman to understand. Because of the significant hormonal changes in your body, it's kind of like a reverse experience in puberty, because puberty is getting your body ready to have the baby and to be able to bear children, whereas menopause is reversing that so that you can no longer have them. So if you consider the massive hormonal changes that happen in puberty, you've then kind of got a repeat of that in the menopause. There are lots of treatments and support services available to women experiencing menopause. In men, they might experience erectile dysfunction. So these are erection problems. They might also be known as impotence. They are really common, especially in men over the age of 40. There's nothing to be ashamed of. It can happen to absolutely anybody that has a penis. And most men will occasionally fail to get or to keep an erection. It's quite often caused by basic things like stress and tiredness. If you're stressed about something at work, it can have a massive impact on everything, including erections. It could be anxiety, you could be drinking a little bit too much alcohol. There's nothing to worry about. If it's happening often, it could be caused by a physical health issue, emotional health issues. But again, there are treatments for this. There are support services that can help with this. You may have heard of the branded treatment Viagra. Men can take that and it can help them to maintain an erection. And it's all about dealing with blood flow and the blood flow to the penis to be able to get or maintain that erection. Totally normal if it happens, especially over the age of 40. It could just be a sign that you are stressed out, that you need a little bit more sleep. On this slide, you have some information about various support networks around fertility. You've got information on Step 2, James and Hale. We're working together as a partnership to deliver relationships and sex education across the Bradford district. We would be happy to have people contact us to ask us questions about fertility, and what we can't answer, we'll be able to signpost you in appropriate directions. Step 2 also have a newsletter that you can sign up to on their website, and that's more aimed at professionals. You've got the social media handles there for people to contact us directly, or of course there's the other YouTube videos as well. The NHS is the best source of information about fertility in England, what treatments you can have, etc. But there are other options. So there's Fertility Network UK there in the top right corner, and there's Fertility for men's fertility that you can contact to ask questions. And there's also the Menopause charity, working to show that menopause is a natural process, but that women may need extra help and support through it.